Whooping cough, also known as pertussis, doesn't always look the same in every patient. In infants, it can be life-threatening. In adults, it can sometimes be mistaken for just another stubborn cough. In this episode, we'll uncover how doctors diagnose whooping cough and the treatments that can make all the difference, especially when time is critical. Doctors usually start with symptoms. Classic signs include prolonged coughing fits that can last for weeks, the distinctive whoop sound when breathing in after a cough. In infants, instead of the whoop, doctors may see pauses in breathing, known as apnea. But symptoms alone aren't always enough. Early whooping cough looks a lot like the common cold. That's why medical testing is key. To confirm whooping cough, doctors use specialized tests. The most common is a nasopharyngeal swab, a small sample taken from the back of the nose or throat. This sample is tested using PCR, polymerase chain reaction, a rapid test that detects the DNA of Bordetella pertussis. Culture tests, where the bacteria is grown in a lab. Though slower, it provides solid confirmation. Blood tests, sometimes used in later stages to check for antibodies. Together, these tools help doctors make an accurate diagnosis and start treatment as soon as possible. Once diagnosed, treatment begins quickly. The mainstay is antibiotics, usually from a macrolide group, like azithromycin, clarithromycin, or erythromycin. Antibiotics work best if given early in the illness, as they reduce the severity of symptoms and prevent spreading the infection to others. For infants, who are at the highest risk, hospitalization may be necessary. There, babies can receive oxygen therapy to help with breathing, intravenous fluids if they're unable to feed properly, careful monitoring for dangerous complications like pneumonia or seizures. Adults and teens often recover at home, but supportive care, rest, fluids, and managing coughing fits remains essential. Early diagnosis doesn't just save lives, it also protects communities. Catching whooping cough early prevents long hospital stays, reduces complications, and stops outbreaks before they spread to schools, workplaces, and households. In the next episode, we'll explore the most powerful tool we have against whooping cough, vaccination, how it works, who needs it, and why booster shots are so important. Make sure to like this video, subscribe, and share it with someone who could benefit from knowing how whooping cough is diagnosed and treated. Knowledge saves lives.